So why do hemorrhoids occur during pregnancy? There are several reasons why hemorrhoids are much more common for women in the state of pregnancy during the second and third trimester in particular. The first is that the blood flow through the veins, the volume of blood that is circulating, increases during pregnancy. That increased volume that's circulating, the water retention that occurs during pregnancy, increases the pressure on the walls of the vein and increases the chance that a hemorrhoid could engorge and get bigger. The second is that progesterone, which is increased during pregnancy, causes the walls of the vein to be a little bit more elastic. They can stretch out a little bit more. And when hemorrhoids engorge out or balloon out, that's when they tend to become symptomatic. The third is that there are increases in pressure of the veins due to the uterus getting enlarged, and the veins cannot clear the blood that is sitting in them, and it's much more likely that blood pools in those areas and causes pressure on the walls of the vein, all of which can increase pregnancy. The last scenario where women in relation to pregnancy develop hemorrhoids is during birth. There's a lot of pressure. As women who've ever had a child know, there's a lot of pressure that's involved in those. It's not uncommon during the process of labor and delivery to develop hemorrhoids. It's certainly less common with a cesarean or a C-section. Vaginal deliveries are much more common to cause hemorrhoids. I get very encouraged when I see a woman come to see me prior to becoming pregnant. If a woman is planning on becoming pregnant who has symptomatic hemorrhoids, they will only get worse during pregnancy, and I think it's very important that women treat these before becoming pregnant. A lot of the options that we have to treat hemorrhoids during pregnancy are limited because of the pregnancy and the potential risk to the baby. We're limited in the medicines we can use. Surgery is certainly not an option unless it's an emergency situation. And hemorrhoid band ligation, which is a technique, a non-surgical painless technique that I specialize in, that cannot be performed when a woman is pregnant because studies have shown that it can cause premature labor. So the best time to take care of hemorrhoids is prior to becoming pregnant. Now, if a woman is symptomatic during a pregnancy, there's certainly medications that we can give and things that we can do to symptomatically make them feel better. They are band-aids on the problem until after delivery, where we can really solve the actual cause of the problem. The technique that I specialize in is a painless and non-surgical treatment for hemorrhoids called hemorrhoid band ligation. It's a procedure that's been around for quite a while. It's an office-based procedure, and patients, after several treatments, about 95% of patients are free of the symptoms that they came in for the hemorrhoids. What it is, it's a disposable device that is used to suction in the internal hemorrhoids. Now, on internal hemorrhoids, there are no nerve endings. It's above the nerve line. And so we're able to suction in the hemorrhoid and place a tiny little rubber band at the end of that hemorrhoid. What it does is that cuts off the blood supply to that hemorrhoid, and it falls off on its own painlessly within the next couple days. What patients experience and feel when we place the band is they feel a dull pressure sensation. They feel a little bit of fullness. It feels sort of like the slight urge to need to have a bowel movement. And that doesn't last very long. It's about 6 to 12 hours. Most patients walk out of the office feeling nothing at all. And we do one treatment every 2 weeks because we like to treat one at a time. We know that the risk of the procedure is much less when we treat one at a time. The risks of the procedure are bleeding, pain, and infection. Those risks are much less than 1% chance when we treat one at a time, and we do them every 2 weeks until the symptoms are gone. On average, patients need about 3 treatments before they're free of the symptoms. So it's a process. It's not an immediate result, but the beauty of it is that it's painless. Patients don't miss any work. It's certainly a lot cheaper than surgery. It's less painful than surgery. Surgery usually does cut across the nerve line, and they use staple or sutures to close that defect, and there's a 2 to 3 week recovery to surgery. There's no anesthesia involved because it's painless. So there's a lot of benefits, and it works about 95% of the time. There are certain patients who are not good candidates for hemorrhoid band ligation. We grade these patients from stage 1 to 4. 1 is the smallest hemorrhoid. 4 is very large and prolapsed, coming out, that cannot be pushed back in. Grade 4 is difficult to treat with band ligation, but the majority of patients are grades 1, 2, and 3. and those typically do really well with hemorrhoid band ligation.